Hi, I'm Shelley Deitmeyer with Physical Therapy Solutions, and I'm here today to talk a little bit about Parkinson's disease. This is a disease of the nervous system. It is progressive, and it's most highly known as affecting one's movement or the ability to move. It does develop very gradually, some starting with very subtle signs, but then as the disease progresses, you'll see the more telltale signs and symptoms that I'll be talking about here today. Some of those, probably the most common sign or symptom that you're going to see is tremors, especially they'll start in the hand, typically one hand, but sometimes both. You'll have stiffness, slowing of movement. They may lack facial expression when you're talking to them. When you see someone walking down the street or in the store, you're going to see a lack of arm swing when they're walking. When you're talking with some patients with Parkinson's, they may have a very soft voice or soft speech and even slurred sometimes because it can affect that as well. And you may even see at home writing changes as they're writing checks or writing notes. They notice the changes there as well. Overall, it's their ability to move or even their perception of movement that is affected. Unfortunately, there is no cure as it is a progressive disease and will just gradually get worse, but there has been so many advances with medications to help, especially with tremors and stiffness type issues that people have. Probably one of the new exciting things that we've had that now therapy can help with is a program called LSVT BIG. LSVT is an acronym that stands for Lee Silverman Voice Treatment. So this started a long time ago, actually with a lady by the name of Lee Silverman who had Parkinson's, and she was really losing her ability to speak and people couldn't understand her. And a couple speech therapists started working with her and kind of developed this program and had such wonderful results with her. And so therefore the program was named after her. So LSVT comes after this patient's name. After a few years of working with the speech population, with the patients, they said, well, hey, if they had that much luck with the speech, why can't we do this with the physical movements and see if that makes things better as well? And that's where we come into play, and the LSVT BIG program came into play. So I'm going to talk a little bit about that program because it is an exciting program that we do offer here now at our Dyersville office as well as our Manchester office. Josiah Polito and Michelle Connor are now LSVT certified over at our Manchester office, and myself as well as Ted Cruzy are certified here at our Dyersville office. So what this entails, I'll talk a little bit about the program itself and then explain what it would, if interested, what it would take to start the program. So there's about five components of the program itself, and the first component is a daily exercise. There's 8 daily exercises that we go through with the patient every day. And basically, as one has Parkinson's, their movements become very small, or their perception of movement becomes very small. So what we do with the LSVT program is make the movements very big. For example, we have some sitting exercises that we do where you sit out big, down, reach up towards the ceiling, out and around, and you're really working on big movements. So we have a couple sitting ones that we do. We also have some standing ones that we do where we're doing big movements, big steps, big arm swings, just to break that small movement pattern that the Parkinson's patients have. We also have adaptations for people if they can't move that well or if their balance is more affected. We can adjust these exercises to make them safe for anybody to do no matter where they're at in the disease process. So that's the first aspect of the LSVT program. The second one is it focuses on what they call daily component exercises. These are tasks that you do every day that might be difficult, like putting your coat on, brushing your teeth, writing a note or writing your checks, putting your shoes on or off, or getting in and out of bed or in and out of a car. So we pick a few of the tasks that are very difficult for you to do and give you cues and suggestions on how to make those tasks easier. The third component is big walking. So a lot of times with the daily exercises, you focus on the big movements, and then we want to just get that overturned into the walking that they do as well, to get those big movements back into their daily walking as well. The last component is a carryover task. So depending on what you're doing here after you leave therapy for the day, we want to try to pick an item or a task that you're going to be doing and make you think about moving big during that task, so that way it's not just here in therapy that you're moving in a bigger, better way, but also at home. So that's kind of in a nutshell what our LSVT program is. Now, the program itself is 4 times a week for 4 weeks. So there's a total of 16 treatments that are done. Most often, our patients that we see with Parkinson's are probably going to be Medicare patients. So with those, we do need a doctor's referral. All of the area neurologists here in Dubuque, Manchester, Cedar Rapids are very well aware that we have this program and are very supportive of this program because they've seen very good results. But it's something that you can always talk with your neurologist and to get a referral to come and see us. So that's what it takes to get things started. The other note that I'd like to end with is that they really highly recommend, as soon as you get the diagnosis, to start the program. We've seen probably 10-15 patients so far at all different areas of progression of the disease, and if you can start it earlier, it definitely is beneficial. So if you have any further comments or questions, just want to talk to Ted or I, or Josiah or Michelle, you can call our area offices. Another great tool is a website for the LSVT program, and that is www.lsvtglobal.com, which has a wonderful video on there, especially for the speech component, that I'd highly recommend you to watch because it is very informative. Again, any questions, you can call either office and we'd be happy to help you and answer any questions that you might have. Thank you.